Have you ever heard of nephrotic syndrome? It's a bit of a mouthful, isn't it? Well, it's a kidney disorder, a condition where your kidneys, those bean-shaped organs sitting just below your ribcage, start excreting too much protein into your urine. But why should you care about proteins in your urine? You see, proteins, especially albumin, play a crucial role in your body. They keep your blood from leaking out of the blood vessels, among other things. When your kidneys start losing these proteins, it leads to a triad of symptoms: proteinuria, meaning high levels of protein in the urine; hypoalbuminemia, which is low levels of albumin in the blood; and edema, a fancy way of saying swelling, particularly in your legs, ankles, and feet. So, nephrotic syndrome is not a disease in itself, but a manifestation of an underlying disease that damages the kidney's filtering system. Now, you may wonder what causes this syndrome? Well, nephrotic syndrome is not a disease itself, but rather a group of symptoms indicating that something is damaging the kidneys, specifically the tiny blood vessels or the glomeruli. These vessels are the ones responsible for filtering waste and excess water from your blood. Let's talk about some diseases that can cause this damage. First on the list is diabetic kidney disease. As you might know, diabetes is a condition that alters the way your body uses blood sugar. Over time, high blood sugar levels can damage these glomeruli, leading to kidney problems, including nephrotic syndrome. Next up is minimal change disease. This condition is the most common cause of nephrotic syndrome in children. It's called minimal change because the damage can't be seen in regular microscopic examination, but only under an electron microscope. We also have lupus nephritis, a serious complication of systemic lupus erythematosus, an autoimmune disease. In this condition, your body's immune system mistakenly attacks your own tissues, including the kidneys. Now, what about the risk factors? Being male slightly increases the risk of developing nephrotic syndrome. Additionally, certain ethnic backgrounds have been associated with a higher risk. For instance, people of South Asian descent, including Indians and Bangladeshis, as well as African and Afro-Caribbean people, are often at a higher risk. However, it's essential to note that these risk factors don't mean you'll definitely develop the syndrome. They just mean that you may have a higher chance compared to others. And having none of these risk factors doesn't mean you are completely free from the possibility of developing nephrotic syndrome. So, it's always crucial to maintain good health habits, monitor any existing health conditions like diabetes, and have regular checkups, especially if you have a higher risk. As you can see, several factors contribute to the development of nephrotic syndrome. So, how would you know if you have nephrotic syndrome? This question might have crossed your mind, especially after learning about what causes this condition. Well, one of the most striking signs of nephrotic syndrome is swelling in the ankles and feet, also known as edema. This swelling isn't your typical post-long day foot fatigue. It's persistent, and it doesn't just go away with a good night's sleep. The next symptom to watch out for is foamy urine. Now, you might be wondering, foamy urine, what does that even mean? Picture the froth on a freshly poured glass of beer. If your urine has a similar appearance, it could be a sign of excessive protein, which is a hallmark of nephrotic syndrome. Another symptom to be aware of is unexplained weight gain. Now, we're not talking about the kind of weight gain that comes from indulging in too many treats. This weight gain is due to fluid retention, a key characteristic of nephrotic syndrome. You might notice your clothes fitting tighter or your face appearing puffier. Keep in mind that these symptoms can develop slowly over time. You might not even realize they're happening at first. They can be so subtle that you might mistake them for signs of less serious conditions. That's why it's crucial to listen to your body and seek medical attention if something doesn't feel right. Also, remember that these are just some of the most common symptoms. Nephrotic syndrome can present differently in different people, and there may be other symptoms such as fatigue, loss of appetite, or malaise. In conclusion, recognizing the signs of nephrotic syndrome can be a bit tricky due to their subtlety and slow development. However, being aware of these symptoms, swelling in the ankles and feet, foamy urine, and unexplained weight gain due to fluid retention can be a significant first step in getting a timely diagnosis. Paying attention to these signs can help early detection and treatment of nephrotic syndrome. So, don't ignore these symptoms. After all, your health is your wealth and you want to protect it at all costs. Now, how do medical professionals diagnose and treat nephrotic syndrome? When suspecting nephrotic syndrome, doctors typically start by conducting a urine test. This test is used to detect the presence of excessive protein, which is a hallmark of the condition. If protein levels are significantly high, the doctor may then opt to perform a blood test. This test can provide insights into the overall kidney function by measuring the levels of waste products such as creatinine and urea. In some cases, a kidney biopsy may be necessary. This involves the removal of a small kidney tissue sample for further examination under a microscope. The biopsy can reveal the extent of the kidney damage and help determine the underlying cause of nephrotic syndrome. After a confirmed diagnosis, the treatment plan is customized based on the root cause, the patient's overall health, and the severity of the syndrome. The main goal of treatment is to control the symptoms, prevent complications, and slow the progression of the disease. Medications are often the first line of treatment. These may include corticosteroids to reduce inflammation, blood pressure medications to keep the kidneys from working too hard, and diuretics to help the body get rid of excess fluid. In some instances, anticoagulants may be prescribed to prevent blood clots, a complication that can arise from the syndrome. In addition to medications, dietary modifications play a crucial role in managing nephrotic syndrome. A diet low in sodium and protein can help control symptoms and prevent further kidney damage. For severe or advanced cases of nephrotic syndrome where the kidneys have stopped functioning, dialysis or a kidney transplant may be necessary. Dialysis involves the removal of waste products from the blood using a machine, while a kidney transplant involves replacing the damaged kidney with a healthy one from a donor. As you can see, the journey from diagnosis to treatment of nephrotic syndrome involves several steps, each crucial in its own right. Early diagnosis and proper treatment can help control nephrotic syndrome and reduce complications. So, if you or someone you know is showing symptoms, don't hesitate to seek medical help. Living with nephrotic syndrome can be challenging, but it's not impossible. Life with any chronic illness requires adjustments, and nephrotic syndrome is no exception. But don't worry, these changes are manageable and can drastically improve your quality of life. One of the first steps towards managing nephrotic syndrome is making dietary modifications. Limiting salt intake is crucial. Excessive salt can lead to fluid retention and worsen swelling, a common symptom of the syndrome. So, spice things up with herbs and spices instead of reaching for the salt shaker. Next, protein. While protein is an essential part of our diet, it's important to monitor your intake. Too much protein can strain your kidneys, but too little can lead to malnutrition. It's a delicate balancing act, so consult with a dietitian to establish a diet that suits your needs. Exercise is another key component. Regular physical activity can help maintain a healthy body weight, lower blood pressure, and reduce cholesterol levels, all of which are beneficial for kidney health. However, it's important to remember that every person's capacity for exercise is different. Always consult with your healthcare provider to determine a safe and effective exercise regimen for you. Then there are medications. Medications are a cornerstone in managing nephrotic syndrome. They help control symptoms and slow the progression of the disease. It's absolutely essential to take your medications as prescribed, even when you're feeling well. Skipping doses can lead to flare-ups and potentially serious complications. Lastly, regular medical checkups are vital. They allow your healthcare provider to monitor your progress, make necessary adjustments to your treatment plan, and catch any potential complications early. Living with nephrotic syndrome may seem daunting at first, but remember, you're not alone. There's a whole community of people out there going through the same journey. Reach out, share your experiences, learn from others, and never lose hope. Remember, a healthy lifestyle is a key factor in managing nephrotic syndrome. And with the right approach and mindset, you can lead a fulfilling life despite the challenges. We've come a long way in understanding nephrotic syndrome. Today, we've explored this condition in depth, starting from its basic definition. Nephrotic syndrome is a kidney disorder leading to an increase in proteins in the urine, which can cause a range of health issues. We've discussed the various factors that can cause this syndrome, from genetic mutations to diseases and infections. We've also highlighted the signs and symptoms to watch out for, like swelling around the eyes and in the lower extremities. Our journey then took us through the processes of diagnosis and treatment, stressing the importance of early detection and the various treatment options available. Living with nephrotic syndrome was also touched upon, underscoring the importance of lifestyle modifications and adherence to prescribed medications. The road to understanding any medical condition can seem daunting, but remember, knowledge is power. Understanding nephrotic syndrome empowers you to take control of your health. Stay healthy, stay informed.